Yeah, one of the things that we looked at recently was we wanted to get an understanding of what patients' perceptions were in regards to using the devices for inhaled medication therapy, whether it be small volume nebulizers or pressurized metered dose inhalers or dry powder inhalers. And a survey like this has never been done. We put this survey together, and over about a month period of time, we had over 200 patients actually show us and tell us what their knowledge was of these different types of devices and their perceptions. A couple interesting things we found out of that is that most of the patients had used a small volume nebulizer before. And the ones that used a small volume nebulizer, over 63% said that they thought that it was effective, and over 50% thought it was easy to use and very rapid onset, which kind of surprised me because I know most of the people that were using the small volume nebulizers are sick in the hospital, and oftentimes they may not remember what they were actually given when they were in, just that they got better and they got out. We also showed that the more interesting one is about a third of the patients really wanted more education on their nebulizers, and they thought that certainly physicians, nurse practitioners, physicians assistants should be the primary people that should educate them on their devices overall. Yeah, it seemed that the small volume nebulizers had a very positive response, meaning that the people that used those nebulizers, again, 63% really liked using them. We didn't really specifically ask which one was the most preferred over the ones out there, but what they did is when they looked at these, they really had a positive reaction to the small volume nebulizers. Well, the biggest unmet need was education. By far and away, a third of the patients really wanted to know more about their educational process. While they said that physicians were responsive to educating them on their process, that only happened in about a third of the instances. And so I think from this, what we took home from this survey is that we really need to do a much better job at educating our patients in regards to the nebulizers. It's interesting because then we followed that up with a physician survey, because we wanted to find out what physicians thought about what their knowledge base was of the different types of devices, and then how good they thought they were doing at doing this. And certainly as a physician, I'm perfect in every stretch of the imagination, so I teach all my patients about this. That wasn't really the case overall. What we found with that group of physicians was that they thought that they were pretty knowledgeable about the devices. 80% thought that they had a good to excellent knowledge base of the different types of devices. However, when you drilled down to it a lot further, only about 50% said that they instructed their patients on how to use the devices, and less than 10% actually instructed the patient how to clean their device. So what we took home from this is that we have to do a better job as care providers of educating our patients about this, and particularly in how when you clean these devices, because each one needs to be cleaned a little bit differently, and you want to keep them clean certainly, so patients don't get infections from the devices themselves, but we need to do a much better job at doing that. When only 10% of us were actually explaining how to clean the devices. I think one of the biggest things is that certainly meetings like this, or any of the big larger meetings where you actually have educational training programs. For those of you that couldn't make this meeting, or those of you that are here, you'll see throughout the exhibit hall and throughout the hallways various types of games that we can get our colleagues to play in learning how to use these different types of devices. The best single way is for me to teach you how to use the device directly and then look back on it and say, okay, you use this device in a correct way, or no, you need to improve in this aspect or another aspect. And we actually did a study on that years ago where we went into a group of care providers giving, it was in a readmission reduction program, where we actually trained the staffs of the reduction program of how to use different devices. And I would test them on a checklist. I give you a device, for example, say, show me how to use it, and I would check off whether you got it right or wrong. And what we showed, we went back a month later. So then we instructed them how to use the devices correctly, went back a month later, studied them again, and the correct response rate went from 70% correct response up to over 92%. So we were able to actually change the behavior of these. They were nurses, respiratory therapists, and pharmacists. We're actually able to change their behavior, and they maintained that behavior a month later. I think types of educational perspectives are out there. Simply to hand me a form, a little package insert that says, here's how you use it, that doesn't work in my opinion. I think you have to really just go out and show somebody how to use it and then test them and retest them, and then that's going to make for better patient care in the long run.